Good morning, everybody. Welcome to our quarterly Employee Awards and Recognition Ceremony. We are here to recognize our team of dedicated employees for their contributions to serving our nation's heroes. My name is Ruth Hatchwell. I'm the Veteran Experience Program Manager here at the Cleveland VA and in the Employee and Patient Experience Service. Our department is designed to enhance our employee and veteran experience and to ensure we continue providing world-class care to our veterans throughout Northeast Ohio. I would like to welcome service chiefs, managers, and executive leaders, as well as support services, people who have come to support their staff, their colleagues, their family members, to honor and recognize and support these awardees. Following the ceremony, we will have a small reception at the back of the hall for our awardees in their honor. I would like to now welcome our Associate Director, Ms. Katina Stone-Jones, who will provide us with some opening remarks.
All right, good morning. It's nice to see so many of you. As Ruth said, I'm Katina Stone-Jones. I'm the Associate Director. I've only been here a few months, so I haven't had an opportunity to meet a lot of you, but I look forward to getting out and meeting you and celebrating you today. I want to welcome you all on behalf of the executive leadership team. It's going to be a great time to celebrate the achievements of our peers, our coworkers, our colleagues. Everything that you all are doing, from years of service to improving care for our patients and our veterans. It's going to be exciting to recognize you this morning. I guess just one comment I want to make is just about how we are moving forward on our journey to high reliability, and how some of the awards that you will see today, whether it's improving care for patients or moving us towards zero harm, highlight that. And I just want to thank you all for what you're doing and to continue us on that journey. That's all I have this morning, so I will turn this over. Thank you.
Thank you, Ms. Stone-Jones. Good morning. My name is Catherine Bird. I'm an education instructor in the Employee Patient Experience Service. I would like to welcome you all here today, especially our awardees. This is an exciting moment for you and a proud moment for us. It is my honor and pleasure to be your mistress of ceremonies today. We will now begin presenting our first awards, starting with the Length of Service Award. VA Northeast Ohio Healthcare System appreciates its employees. Employees make VA not just a job, but a career. It is essential that the VA has experienced and knowledgeable employees to support the mission of the VA. VA Northeast Ohio Healthcare System acknowledges employees with service awards based upon the years of service that an employee has worked at the VA to demonstrate its appreciation for these employees. I am privileged to call up these employees to receive their Length of Service Awards. Please hold your applause until employee in the service group listed have been announced. Ms. Stone-Jones will honor these awardees from the Director's Office. 30 years, Kristen Guadalupe, Quality and Safety. 25 years, Letitia Richardson, Chief of Staff. 'Dr. Margaret Kennard, Acting Chief of Staff, please join us at the podium to honor these awardees from Diagnostic Imaging, Medicine, Neurology, Pathology and Lab, Radiology Oncology, Social Work, Specialty Care, and Surgical Care. 40 years, Donald Botner, Surgical Care. Matthew Studdard, Radiation Oncology. 35 years, Joan Childress Greathouse, Specialty Care. 25 years, Lily Epps, Pathology and Lab. Curtis Donsky, Specialty Care. Sally Nambuderi, Specialty Care. Oh, sorry. Oh, sorry. Sally Nambuderi, Specialty Care. Eric Rodriguez, Primary Care. Myra Rosado, Pathology and Lab. Patrick Till, Surgical Care. 20 years, Donald Ennis, Surgical Care. Jason Ayapana, Specialty Care. Sarah Bowl, Surgical Care. Sonia Curry, Specialty Care Oncology. Ingve Falk Yitter, Specialty Care. Galina Katorian, Neurology. Denise Lester, Specialty Care. Heather Kinsey Lang, Social Work. James Kopko, Specialty Care. Dion Moore, Surgical Care. Stephanie Redman, Social Work. Katie Schreiber, Diagnostic Imaging. Jeffrey Setlak, Social Work. Christina Kazmierzak, Finance. Thomas Shaiwanis, Facilities Management. Michelle Morris, Finance. Robert Pavis, Facilities Management. All right. Thank you, Dr. Kennard. Mr. Andy Pacina, please join us at the podium to honor these awardees from Facilities Management and Fiscal Services. "20 years, Bridget Benderson, Finance. Grazina Kazmierzak, Finance. Thomas Shaiwanis, Facilities Management. Michelle Morris, Finance. Robert Pavis, Facilities Management. Thank you, Mr. Pacina. Mr. Robert Jastrom, please join us at the podium to honor these awardees from Environmental Management and Police and Security Services. 40 years, Michael Mormon, Environmental Management. 20-year, Joshua Bowman, Police and Security. Edward Hayward, Jr., Environmental Management. Thank you, Mr. Jastrom. Dr. Timothy Hyman, Chief of Pharmacy and Community Outpatient Services, will honor these awardees from pharmacy and the VA outpatient clinics. 30 years, Lori Corbin, Community Outpatient Service. Joseph Hanud II, Community Outpatient Service. 25 years, Suzanne Hahn, Community Outpatient Service. Tammy McGill, Community Outpatient Service. Karen Macavina, Community Outpatient Service. Christopher Munick, Community Outpatient Service. Tammy Stennis, Community Outpatient Service. 20 years, Julianne Bralett, Community Outpatient Service. Jeffrey Catron, Community Outpatient Service. Renee Ann Kramer, Community Outpatient Service. Levon Doolin, Community Outpatient Service. Kathleen Jasinski, Community Outpatient Service. John Knight Jr., Community Outpatient Service. Dennis Muntean, Community Outpatient Service. Amy Schumacher, Pharmacy. Thank you, Dr. Hyman. Ms. Katina Stone-Jones, Associate Director, will honor these awardees from Nutrition and Food, Safety and Emergency Management, and Supply Chain Management Logistics. 35 years, Betty Wright, Nutrition and Food. David Palmer, Nutrition and Food. Kim Dudley, Business Office. Violetta Thatch, Health Administration. "25 years, Robert Tomato, Supply Chain Management, Logistics. 20 years, Jason Blindenberg, Safety and Emergency Management. Carlos Mendoza, Safety and Emergency Management. Dennis Super, Health Administration. Thank you, Ms. Stone-Jones. We will honor these awardees from Quality and Patient Safety. 25 years, Bruce Kafer, Quality and Patient Safety Risk. 20 years, Elizabeth Flannery, Quality and Patient Safety. Ms. Natalie Palmieri, Deputy and Associate Director, Patient Care Services, please join us at the podium to honor these awardees from Nursing Service and Sterile Processing. 50 years, Jeanette Wilder, Mental Health. "30 years, Kimberly David Saber, Nursing Operations. Michael Theater, Specialty Care. 25 years, Victoria de Pompey, Nursing Operations. Dwayne Green, Mental Health. Anastasia Muhammad, Nursing GEC. Heather Osborne, Nursing GEC. Kimberly Pyatt, CLC. "20 years, Cliffundrus Ashford, Nursing Operations. Tracy Blanton, Mental Health. Mabel Oyewumi, Ambulatory Care. Lisa Saucer, Mental Health. Valerie Waller, Mental Health. Let's give our length of service awardees a round of applause. We would like to recognize the following nurses who were recognized by the Plain Dealer, Cleveland.com, for the Top Nurses Award. Shayna Dunham, Colleen Casterman, Dustin Glass, Mia Bossel, Portia Bishop, Reagan Crawford, Bridget Bright, and the VA Northeast Ohio Healthcare System Emergency Department. Let's give them a round of applause. We have another special nursing award. VHA's Service to the Citizen Award from the National DoD under the category Using Innovative Technologies to Deliver Simple, Seamless, and Secure Services. Please congratulate Mary Julius, Registered Nurse, National Diabetes Self-Management and Support Quality Manager. It is now time to congratulate the award recipients of the following awards: Daisy Nurse Leader Award, Daisy Nurse Award, VA Chief of Police of the Year, Great Catch Awards, iCare Project Award, Hero Awards, Innovation Awards. Ms. Palmieri, please join us again at the podium to present the Daisy Awards. The Daisy Nurse Leader Award was created to recognize nurse leaders who fully support their direct care staff as they deeply appreciate and respect the care that staff nurses provide. These leaders also understand the value of celebrating the impact staff have on patients and their families through ongoing meaningful recognition. As the healthcare landscape becomes more complex with increasing demands on nurse leaders, we believe that those who create an environment of compassion and recognition for others strongly deserve to be recognized themselves. With recognition, they may be held up as models of outstanding nursing leadership. Despite working under tremendous pressure, through their leadership, these nurse leaders provide a haven of safety for staff, both physically and emotionally. In this environment, nurses are inspired to do their very best by nurse leaders who role model caring behaviors. These leaders provide a setting where compassion is valued and staff, in turn, treat patients and their families with deep humanity.
Good morning. It's an honor to be here to celebrate our Daisy Leader Award, and the winner for this quarter is Janie Fanara, Same Day Center Nurse Manager. So I'm very pleased to be able to share the nomination. It was from her team, and it reads: in her role as nurse manager, Janie consistently embodies the values and qualities that the Daisy Award represents. Janie is an exceptional leader who exemplifies unwavering dedication to patient care. One of her most outstanding qualities is her constant availability. Regardless of the demands of her role, she ensures she is accessible to both patients and staff, providing support and guidance whenever it is needed. Her compassion is evident in every interaction she has. Janie approaches each situation with empathy and understanding, making patients and their families feel heard and valued. She goes above and beyond to ensure that their needs are met and that they feel supported throughout their healthcare journey. One of her most remarkable aspects of her leadership is her commitment to working alongside her team without hesitation, from transporting patients to cleaning carts. She fosters a collaborative environment where every team member feels valued and respected. She sets a powerful example of teamwork and dedication. Janie is incredibly attentive to detail and addresses issues as soon as they arrive. Her proactive approach ensures that potential problems are identified and resolved promptly, contributing to the overall efficiency and effectiveness of our healthcare delivery. She truly embodies our organization's ICARE model, consistently demonstrating integrity, compassion, accountability, respect, and excellence in her practice. Her dedication to evidence-based research is evidence in initiatives such as the ambulatory surgery staffing model, which has significantly improved patient outcomes and staff satisfaction. Furthermore, Janie empowers her staff by encouraging autonomy and fostering a culture of continuous learning and professional development. She recognizes the unique strengths and abilities of each team member and provides them with the support and resources they need to excel in their roles. She exemplifies the qualities of a high reliability organization and encourages the staff to do the same. In summary, Janie is an exceptional nurse manager who embodies the spirit of the Daisy Award. Her compassion, dedication, and commitment to excellence make her truly deserving of this recognition, and we're proud to work alongside her. Please join me in congratulating Ms. Janie Fanara.
The Daisy Award is an international award that recognizes the superhuman work nurses do for patients and families every day. This award gives staff, patients, and families a way to express their gratitude for the compassionate environment nurses provide. Their exceptional and compassionate care is demonstrated by the VA's core values of integrity, commitment, advocacy, respect, and excellence. All VA Northeast Ohio Healthcare System RNs and LPNs are eligible for this award.
All right, and I'm pleased to recognize Ms. Cecilia Washington, RN, as the winner for this quarter. And just quickly to read she was nominated actually by the wife of a veteran that you cared for, Ms. Washington. I'm gonna go ahead and read that nomination. I want to deeply thank Cecilia Washington for her diligent care of my husband. She was right there every night for him, doing everything in her power to make him comfortable. She connected with the doctors and knew all about his surgery and what exactly was done. It was more than just protocol, it was the care from her heart. This nurse is amazing. She goes above and beyond her duties to care for my husband, and thank you, you are amazing.
Thank you, Ms. Palmieri. We have another National VA Award, the National VA Police Chief of the Year Award. This is a single honor for the top chief of police. This annual award is selected from a field of 140 VA chiefs of police. Please congratulate Police Chief Justin Ricker. Our next awards are the Great Catch Awards. Patient safety reporting is important to improving patient care, decreasing adverse events, promoting awareness of possible adverse events, and becoming a high reliability organization. Great Catch Awards are a patient safety continuous improvement initiative to encourage staff to recognize and prevent adverse events. This quarter, we recognize employees who received the Great Catch Awards between July and September 2024. Please welcome Lisa Wozniak from Patient Safety, who will present these awards.
Oh, you switched it up on me. Good morning, or good afternoon. I'm here to present the Great Catch Awards for July, September, August, and September. So for July, we have Kathleen Overy. She's a registered nurse in women's health. Do you have the definition or the descriptions? I don't have them on there. Okay. In the green? Okay, good. So a veteran reported calling into the clinic on a Friday afternoon due to experiencing some vision changes to the left eye that started the day before. The veteran stated, I called the women's clinic on a Friday to leave a message. I don't think I would get a return call until the following day. However, Nurse Kat called me back at 2 p.m. on a Friday and told me to get to the emergency room right now. If she had not called me back right away and told me this, I probably would have lost vision in my eye due to having a retinal detachment. I really thought that it was a sinus issue and nothing serious. I want to let you know that I really appreciate her going above and beyond for being proactive in my care. Let's please congratulate Kathleen Overy, Registered Nurse, Women's Health. Oh, you're switching them. All right, so for August, I would like to present Christine Gasser. So the great catch for Christine was she was informed of an add-on case that they would be getting in the room today. It was for an inpatient with an ischio debridement. They entered the patient's chart to check for consent labs and et cetera. When I found the patient was on a heparin drip on the floor, and the note from general surgery from the weekend wanted it to be turned off for 2 hours prior, called the floor and spoke to the nurse because it didn't seem like they had stopped it and was informed that in fact it had not been stopped. The nurse didn't have an order to stop the heparin. This nurse, Christine, informed the anesthesiologist for her room and went to speak with the doctor who would be performing the surgery. The doctor agreed that she wanted the heparin drip off for at least 4 hours, passed that information on to anesthesia. So let's please congratulate Christine Gasser, registered nurse in the OR. All right, and lastly, we have Sarah Turigno, registered nurse in interventional radiology. So on Monday, July 15th, Sarah was looking up her procedural cases for the day. She recognized a veteran was in the DOM for recovery, receiving daily drug tests, and was prescribed Suboxone. In interventional radiology, they use moderate sedation, fentanyl and midazolam, during the type of procedure that the veteran was scheduled for. Sarah took her findings and voiced her concern to the IARE team. It was discussed between the IARE Dr. Kang and the ordering provider, and the procedure was deemed routine and non-emergent. The procedure was then rescheduled for a later date to allow the veteran to thoroughly complete his recovery process without interruption. So let's please congratulate Sarah Turigno, registered nurse in interventional radiology.
Thank you, Ms. Wozniak. Our next awards are going to the ICARE Project Awards for October 2024. The ICARE Project Award recognizes projects which exemplify the ICARE values: integrity, commitment, advocacy, respect, and excellence. These projects are not limited by topic or source. The project should demonstrate continuous improvement, patient satisfaction, and commitment to caring for our veterans. These projects can also highlight research and innovations in care. The actions being recognized should have occurred within the last 12 months. ICARE Project Award is presented for excellence, striving for the highest quality and continuous improvement, being thoughtful and decisive in leadership, accountable for actions, willing to admit mistakes, and rigorous in correcting them. On behalf of the ICARE Award Committees, I will speak about this project nominations. The first one is Introduction of Whole Health Care to the Primary Care Services. The Medical Center initiative to offer whole health to all veterans was lacking in primary care. The goal was to initiate whole health in primary care by the summer of 2024. Primary care is extremely busy as a service. Due to time factors and coordination of care to include whole health had challenges, it was difficult to envision how this would be implemented. Nursing algorithms of care were established to include whole health. Training was provided to the nursing staff on aromatherapy and the use of electronic tablets with relaxation videos for use in primary care. Management and women's health, which are now expanding to mental health. The team worked to identify areas to involve in this endeavor, coordinated multiple sessions of online training to facilitate the ability to reach the target audience without negatively impacting patient care. They served as a resource to other managers as points of reference for process and coordinated additional trainings as needed, secondary to clinic needs and monitored outcomes. In May of 24, the number of whole health encounters for PACT was 0. Following a 3-month training of staff, over 170 visits for whole health in care management appointments were recorded. From May 1st to July 23rd, 24, 180 tablet usage notes were recorded through a data pool prior to Power BI. From July 23rd to September 30th, 24, a total of 294 notes were recorded through a data pool on Power BI and Health Factors. Whole health is now increasingly becoming part of the conversation in our primary care clinics. The hope is that this will increase our whole health encounters, which will also increase Vera funding for the medical center. We continue to look at our algorithms for care and build this into the time as a priority for chronic disease management. We are educating more nurses and encouraging them to offer whole health to veterans. Please congratulate the team member representatives, Victoria Hamry, Patricia Kiefer, and Doris Somple-J. Our next award is for the inpatient television system deployment. Prior to this project, the existing inpatient television systems were outdated, consisting of basic cable TV services only. The healthcare technology section of COPS developed a plan to replace all inpatient TVs with network-based smart TVs capable of documenting inpatients' records. The system is ready to go live with CPRS integration of patient education and will integrate with the Oracle Health Cerner. In total, 586 screens at the main medical center were replaced, 22 were installed at the Midtown Dialysis Center, 11 at the Akron Infusion Clinic. The system has been well received by both staff and patients. Many veterans shared comments like, "Amazing picture, better than at home, easy to navigate, and a genuine thank you very much, this is wonderful." Staff shared their excitement about the capabilities of the robust customization and the ability to document education in the veteran's record. The entire team worked many long nights and very long hours to accomplish this project. They worked with vendors to install each individual system, escorting them at all hours of the night to complete the initiative. Healthcare Technologies was contacted by the National VA OINT Information Security Leadership and were tasked with assisting in the development of a standard security framework for all patient TB systems VA-wide. The VHA's Deputy Undersecretary for Nursing Services requested a demo of the inpatient TB system. Healthcare Technologies is currently working with the National EHRM team to integrate the inpatient TB system with the soon-to-be onboarded new electronic health record VA-wide. The team is sharing their standardization project and process and connectivity they designed to reflect current use case scenarios pertinent to VA Northeast Ohio healthcare system, focusing and factoring other services available on the platform that other VAs may benefit from, future-proofing the standard for all VAs, all the way of an updated revised documentation that spells out national standards and compliance. The Healthcare Technology Section team is an important asset to this organization. Through their tireless efforts and ingenuity, they have improved the inpatient stays and the lives of countless veterans across the country. Please congratulate the team members Nick Calabrese, Rachel Emery, Nicholas Neenan, and Eric Vignal.
We will now present the Hero Awards for Quarter 3, 2024. The National Hero Award recognizes staff members who advance VHA's journey to high reliability by demonstrating VHA's high reliability organization principles in action. These may include going above and beyond in patient care or workplace safety, making a change in a process or procedure that positively impacts patient care or workplace safety, serving as a role model or peer champion of HRO, or leveraging safety practices to perform well in a crisis or emergency situation. Nominations can be submitted in 4 categories: clinical individual, non-clinical individual, clinical team, and non-clinical team. Any individual can submit a nomination to recognize a group or an individual. Nominations are accepted on a running basis, but are reviewed quarterly on the local level, and awardees in 4 categories are selected. These selections are further nominated to the Vision 10 level of Hero Award, and if selected by Vision 10, are then submitted as nominees for the National Hero Award. Ms. Marina Viscoon will present these awards. The following awardees have received the VA Northeast Ohio Healthcare System Hero Awards. Hero Award Clinical Team category, CLC Wound Care Team.
So, CLC often receives patients who arrive with pressure wounds and has developed a multidisciplinary wound care, nursing, medical, and dietary staff team to provide continuous wound care. In December 2023, 2 veterans were admitted with severe pressure wounds. Veteran 1 had 7 pressure injuries, all stage 3 or greater, and Veteran 2 had large fasciotomy wounds on both legs from a Cleveland Clinic surgery and was to return for a 4-hour surgery for skin grafting. The CLC multidisciplinary team, again, against all odds and expectation, achieved the results of completely healing 6 of 7 pressure wounds for Veteran 1 in less than 2 months. And Veteran 2 was sent back from the Cleveland Clinic without his skin grafting surgery because he no longer needed it. These 2 cases are just some of the examples of the standardized systematic approach to wound care used across all CLC floors, part of daily routine, which increases the standard of care and customization as needed. The team's sensitivity to operations has led to measurable results, and I lost my track, in improvements to the systems and processes. The staff have clear goals, which has become a learned and practiced behavior. Additionally, CLC staff's preoccupation with failure is high to address existing wounds, to prevent the development of new wounds, and eliminating the risk of the consequences of these wounds. The reluctance to simplify and deference to expertise go hand in hand as the team gets to the root causes of the injuries, making the CLC multidisciplinary wound care team into heroes who provide an example of how their daily practices and use of HRO principles impacts the lives of our patients. Please congratulate Roseanne Diebold, RN, Cheryl Malik, BSN, RN, and Samantha Yurko, LPN, who are representing the team today. Our next Hero Award goes to Non-Clinical Team category for Flex Brush Project at Acute Mental Health Ward. In January 2024, psychiatry nursing team was informed of a potential hazard on an inpatient acute mental health unit that patients can sharpen the handles of their toothbrushes against the bathroom floor drain, grates, or other sharp objects. This led to the assessment of CT6 products and practices to find solutions and alternatives. Nursing and logistics work together on the standard bidding requirements override to expedite the process and overcome barriers. Nursing researched and found a safe toothbrush alternative while immediately removing and continuously monitoring the toothbrush use until arrival of new brushes. By April 2024, a small batch of new Flex brushes were ordered. By May, those brushes were officially approved, and in June, the flexible handle safety toothbrush, an ADA-accepted non-shank, weapon-proof design was in stock. The expedient response, collaboration, and implementation resulted in removing risk and establishing a safe environment of care for our patients and staff on the acute psychiatry unit. This also led to waste reduction. Toiletry products are now provided on as needed or requested basis. Staff sensitivity to operations focused on the quality care and appropriate processes where systems checks impacted patient care and safety. Their preoccupation with failure, reluctance to simplify on multiple levels, research, expedient process, and the continuous flexibility to overcome barriers completely changed the process of providing an admission while removing the risks related to the use of hard-handled toothbrush as a weapon. The team relied on their deference to expertise to collaborate on their efforts to shepherd the change in the appropriate areas, which led to breakdown of potential silos and reduction in communication risks. Additionally, this team was Vision 10 winner and was nominated to the National Hero Award. So please congratulate Rhonda Beach, RN, Cynthia McCallum, RN, and James Scullin, who are representing the team. Our next Hero Award goes to the in the Clinical Individual category for the Wandering Patient event. In February 2024, a veteran with cognitive issues wandered from his assisted living and was found by local police in the field, fortunately without injury. Julie Smith, PACT social worker, took the necessary steps to report and address the situation. Ms. Smith contacted the Ohio Long-Term Care Ombudsman and requested patient's capacity evaluation by the primary care provider. Delving to the root causes, Julie inquired about best practices and determined that the management of wandering and missing patients, VHA Directive 2010-052, states that each CBOC should conduct an annual drill or participate in a real wandering or missing patient situation as necessary. The VA Northeast Ohio Healthcare System Patient Safety Management Team was notified, who checked with the CBOCs whether they were aware of this requirement and were these drills conducted. As a result, patient safety and CBOC leadership now conducts such drills, a change in the system and processes that improve patient care and safety. Julie Smith's sensitivity to operations led to a review of best practices and outreach to various Ohio entities for assistance with wandering or missing patients. Ms. Smith's preoccupation with failure and reluctance to simplify brought to light the existence of a wandering or missing patient VHA directive that impacted every CBOC, improving annual compliance within the process. As a result, as part of the commitment to resilience, CBOC staff are now knowledgeable on the prevention and effective management of wandering and missing patient events. Ms. Smith tenacity led to course correction at VA Northeast Ohio Healthcare System that will increase patient safety and decrease the risk to patients across 21 counties in our catchment area. Please congratulate Julie D. Smith, licensed independent social worker. And last but not least, we have Hero Award Non-Clinical Individual category for leadership in SPS and impact on optimization. Mr. Kevin Price is a skilled medical supply technician in the sterile processing service and one of the key personnel of the year-long SPS optimization project. He became a preceptor and mentor for both new and current employees, and this, along with his leadership skills, work ethics, and communication style, have resulted in Mr. Price's promotion to lead tech position. Some of Kelvin's achievements include being a member of multiple work groups, proactive in originating and leading process testing, and communicating changes to peers, including input from others to benefit the team processes, ensuring that new staff positively impact the service, and problem-solving surgical crisis situations. Also, improvements to the decontamination and preparation areas of SPS, being a resource of types and numbers of needed equipment, and improving workplace safety. Mr. Price's sensitivity to operations is represented in his daily work and even more strongly in the extracurricular activities. His input into the hiring processes ensures that SPS and its culture focus on safety of personnel and veterans. Kelvin's preoccupation with failure and being able to see both small and big picture issues lead to proactive and timely changes, readiness, and ability to react when an emergency occurs, and new and improved systemic changes that lead to prevention and reduction of potential failures. Mr. Price's inquisitive and detailed approach inspires others because he is reluctant to simplify, looks for root causes of problems, and proposes solutions that fit and address the concerns. However, he still defers to expertise to hear and incorporate others' input, which then leads to staff empowerment and collaboration. Please congratulate Kevin Price Jr., Certified MST from SPS.
Thank you, Mr. Schoon. Last but not least, we are going to recognize our Innovations Network awardees. Please welcome Mr. Rob Jastrom to the podium to present these awards. MIT Catalyst Fellow, Sarah Carbone. Sarah is a Fellows Innovations awardee. Our next Innovations Fellow is VHA Innovations Ecosystem Fellow, Mary Julius. The next group of awardees have the Vision 10 Innovation Grant awardees. Insulin Clock, Lydia Dowell. On-Water Rowing Program for Veterans with Spinal Cord Injury or Paralysis, Dakota Noble. Optical Coherence Tomography, Warren Sobel. Portable Stairs, Kevin Brachetti. Single-Use Device Recycling, Sean Hulsman. Remember When, Samir Ben Abdallah, Juliet Ratty, and Akisha Washington. Thank you, Mr. Jastrom. Let's give all of our awardees a round of applause. Once again, I'd like to thank Catherine for being our mistress of ceremonies for today's award ceremony. And in closing, I'd like to congratulate all of you, our wonderful awardees who have done some amazing work here at the VA Northeast Ohio Healthcare System, and to all of you that have come here today to support them. Thank you so much. The awards for those employees who were not able to be here in person today will be delivered to your chiefs or your services administrative associates to be distributed to you within the next week or so. We'd like to also thank our chiefs and our administrative staff who have assisted with this program, and thank you, Ms. Stone-Jones, for being here to represent our director today. Have a wonderful day, and congratulations to everyone.